Hi, it's KuyaMike and Happy New Year! Hopefully this year is going to be great because last year, 2020, what was that all about? This email isn't actually one that requires an opinion, it's more of a message from someone in the community that is very frustrated. And after I read this, you'll understand why. It has to do with the current situation the whole world is facing. So let's get to it. Dear KuyaMike, I'm a nurse working in a hospital locally, and I would like to just share my 2 cents worth and a bit of insight regarding this COVID situation. I get a little bit frustrated. No, let me correct that. I get really frustrated how people seem to not care about it. I get it. I'm one of those people who are really tired of this shit and who wants to get back to the way things were. However, I can't escape this reality, and the only thing I can do is deal with it. I would like to just share some insight on what this virus is and how it feels like to be sick and to be one of those people who actually deals with it on a daily basis, being that I work in a hospital. Number 1. COVID is real. No matter what type of conspiracy theory you believe in, this virus is real and it's deadly. No, it's not just the flu, and you believing that you'll only have mild symptoms is like rolling a dice at the devil's table. You will never know how severe your body will react to it when you get ill. Number 2. Wear a mask unless you are medically unable to, and sanitize your hands. Current evidence suggests that COVID is transferred through tiny droplets from your mouth and nose. This can be transferred by sneezing, coughing, or even merely talking to someone. Masks catch these small droplets and prevent spread. Touching your face and passing it on by touching other objects can also transfer these small microscopic droplets, and that is why regularly washing/sanitizing your hands is very important. Number 3, please social distance. And what I mean by social distance is no gatherings as much as you can. Limit the amount of times you go out for a coffee to meet a friend. Even if it's just one person outside of your household, it's not physically possible to find out who your friend has actually made contact with. This is an invisible enemy and you can't possibly know who is an actual carrier and who isn't. Asymptomatic carriers, which means those who have the virus but don't show the symptoms, are the number 1 spreaders. Number 4, think about everyone else. If you think you are well enough to power through this disease, your mum, your dad, your nan, etc. may not be able to. Don't be selfish. Working in a hospital, I inevitably caught this virus. I had it. I had COVID, and in a nutshell, it feels like you're choked. It's extremely difficult to breathe, your body is on fire, and all of your muscles feel like you've just gone to the gym for the first time in years. Best case scenario is you'll experience absolute discomfort like that. But let's respect those that have unfortunately lost to this virus. Number 5. Hospitals will be or may already be on the brink of collapse. Some hospitals are running out of oxygen, literally. Frontline healthcare staff are overworked, exhausted emotionally, physically, mentally, and spiritually. And we are already used to this tremendous amount of stress and seeing death on a daily basis. So for us to say this is actually a very bold statement. This disease is the greatest challenge of any healthcare system or any medical profession of our generation. And it may reach a point where healthcare staff will be making a difficult decision on who gets to live and who doesn't. No exaggeration, that's just the truth. Vaccines? Yes, I support 100% the use of a vaccine. But if you have any medical history, consult your GP prior to getting one. So this email is getting too long and I may need to make a second email to expand further, if required. If you have any questions, please email KuyaMike and I will gladly be happy to answer your questions for the next time. Otherwise, please do comment. I'm sure there are other nurses or other healthcare staff that have experienced this frustration and want people to appreciate just how difficult this virus is. Everyone watching, I beg of you to please just follow what the government says. It might not be great, but think of it like this. What's a couple of months of lockdown versus the rest of your lives? But if you feel the need to be above the rules, remember this the next time you decide to break them. So here's an image that this person's attached. You don't want to be this. Sincerely yours, Anonymous Nurse. Okay, so it is what it is. This is what someone on the front line has to say about it. So this email doesn't actually require an opinion, but I just wanted to give my 2 cents on it as well. I'll be real with you guys. I actually had to record reading this email a few times because the email had like a lot of spelling mistakes and typos, and I guess it's because of how frustrated the person felt while writing this. Imagine being in this person's position where you've been working on the front lines and putting your life at risk, and also your loved ones, while everyone else is just basically not being accountable for their actions. It's sort of like an insult to the efforts that everyone is making towards trying to contain this virus. I mean, fair enough, there's no way we can contain this virus, but best we could do is slow the spread, right? I mean, other countries are able to do it to a better extent than we are. Like, honestly, as someone from the UK, I personally feel very frustrated and quite frankly ashamed about how we have these first world problems and we complain about just not being able to see friends and so on. Like, I get it. I mean, I'd be lying if I say I didn't sneak out once or twice to see a friend or not, but there were very, very particular circumstances as to why that happened. But at the end of the day, as someone that isn't working on the front lines, I'm trying to do my part as well to stay indoors and away. Like whenever I do grocery shopping, I try to go as early as possible, try to avoid the crowds. And I do this because I know that if I was to get the virus, I'd recover. There's no doubts about that. I like to think I'm still young. I'm gonna be friggin' 30 this year. But the point is, there are those around me that might not necessarily be able to survive this. And I do this because I want to keep those people safe. So I'll just say it straight up. I'm a grandma's boy, and I'm doing my best to keep myself accountable as much as possible, because I wouldn't be able to take it if I knew that I was the reason that someone in my family contracted the virus. So that's myself doing my part. And the thing is, like, in an ideal world, everyone would sort of have that same mentality, I guess. I mean, as a human, we can put our needs aside for now and just do what we can to stand together so that we can all move forward together. Because the thing is, it just takes one person to think that they're above it all. And that person could be, as the nurse said, an asymptomatic carrier. They probably don't think they have the virus because they're not showing any symptoms, but they're the ones actually spreading it. Because that one person can easily become 100 people who think that they can get away with it. And then that's how things spread. And I'm really hoping that people watching can somewhat agree to some extent to like how I see this, and also can put themselves in the nurse's shoes. Like everyone that's working super hard, like what are they doing this for if everyone's just going to ignore and just do whatever they want and continue making the situation worse? As much as possible, I'm sure everyone can, I'm sure there's a lot of people that can appreciate the sentiment where I just want to get back to work and just continue with my life again. Like everyone's lives have been put on hold. I'm no exception. You're no exception. If you're lucky enough to still be working, great. But for those that aren't, then this is a very, very dire situation. Everyone's mental health is being affected. Everyone is extremely stressed, thinking, how am I going to be able to pay the rent, so on and so forth, you know? This virus is becoming more and more infectious. It's evolving, and the best we can do is just everyone just suck it up for now. Stop complaining. I mean, look, yeah, it sucks. I understand the economy right now is but think of it like this, right? At the end of the day, if you contract the virus and die, you're not going to be making more money. So you are your biggest asset. Take care of yourself, make more money another day. That's how I see it. Enjoy what you have now before it's too late. So thanks for watching. I don't think I'm going to plug in my stuff this time. If you're interested in seeing any more stuff, feel free to subscribe. Otherwise, this is a very, very bummer of a topic, and I don't really feel like plugging in my other stuff, you know. So that's that. Thanks for watching.